We'll start off by considering the current landscape of education and training of pharmacists and how the pathway fits into this. We'll then give an overview of the pathway and cover its 4 key elements. We'll briefly cover funding and eligibility as the pathway sign-up is still open. And then we want to articulate our long-term goal for the pathway with you before sharing some sources of further information. So we're hoping we'll finish this at about 12:20, 12:25, at which point we'll have an open Q&A session. So if you've got any questions, then we'll be happy to answer them then. You can start popping them in the chat now and we'll work our way through. What do things look like in pharmacy education and training at the moment? So we know that this won't be new to you, but we think that going through this provides some extra context for what we're trying to achieve with the pathway. So we just want to cover a few key points. We know there is disruption to training due to COVID-19, and that's with the pre-registration on what is now the foundation training being such a critical time. We're aware that people have been coming into the workforce who've had a really challenging couple of years. We also know there's new standards for the initial education and training of pharmacists being introduced. And although there are currently people on the MPharm who are being trained to the previous standards, we know that there'll be phased changes to the undergrad programmes. So each year, the needs of newly qualified pharmacists will be changing. We've also got integrated care systems that are being established. And this is a significant change that way we'll all be working across the NHS. We need to find ways to ensure that the pharmacy workforce is ready to support these new systems. And finally, you might have seen that the GPHC has announced a new group to focus on assurance of post-registration practice of pharmacists. Now, this is still in the early stages, but what we can take from this is the way that pharmacists engage with lifelong learning may be set to change. So what does this mean for newly qualified pharmacists? They'll need to adjust to the demands of the profession and the professional practice, and we know that that's in a changing landscape. They'll need to continue to develop clinical reasoning and complex decision-making skills, recognising the systems which they're working in. They'll need to progress leadership and educational behaviours, and this supports the developing roles and a commitment to lifelong learning. They'll need to apply learning in complex clinical environments and consider how research is embedded into clinical practice. And these 2 final points are reflected in the post-registration foundation curriculum, which we'll come on to shortly. So we know that this is a lot for newly qualified pharmacists to be considering, but we hope that supporting pharmacists develop these skills at an early stage will help them throughout their career. And here's how we plan to support this, the newly qualified pharmacist pathway. It allows all newly qualified pharmacists to access consistent opportunities. We're aware that some trusts will have an established programme in place, and they may want to just select certain elements of the pathway. But other trusts who have less well-established programmes can use the pathway to offer learners more structure. The pathway offers support for pharmacists in the early stages of their career to meet their personal development needs. And this is both achieved by identifying what these needs are and also recognising their personal and professional growth as they progress throughout the pathway. And of course, we recognise that one-size-fits-all approach is not what's needed. This pathway is optional, learner-led and designed to fit around working practice. Ultimately, the aim is to enable people to progress from foundation practice through to career development pathways, including advanced practice and consultant level practice. And as you can see from the diagram, we see this as a continuum of learning, which starts from the MPharm and takes people on a journey from fully directed to fully self-directed learning. We want to help provide a more seamless transition from the foundation training year into the newly qualified years and on to advanced practice. So I'll now hand over to Alison, who will take us through the 4 key elements of the pathway.
Okay, can you hear me okay? Yeah, perfect. Thank you, Annie. Yeah, like Annie just said, there's essentially 4 key elements of the newly qualified pharmacist pathway: the curriculum, e-portfolio, resources and access to supervision. So I'm just going to take a few minutes now just to look at each of those elements in turn. So a curriculum is essentially the educational content of a learning programme, And for the newly qualified pharmacist pathway, this is the RPS post-registration foundation pharmacist curriculum. So it's a bit of a mouthful, but essentially it's a framework to help structure learning and development. Hopefully you're already aware of this curriculum, you may be familiar with it, but for anyone who isn't, I'm just going to give a really brief overview now. So the framework or the curriculum is split into 5 domains. I'm trying to read that on the slide now: person-centered care and collaboration, professional practice, leadership and management, education and research. And these 5 domains are aligned to the 4 pillars of advanced practice. So like Annie said earlier, this is to really support that continuum of learning, a continuous learning journey from the start of career into, and beyond. So each of the domains of the framework contain a number of learning outcomes, and each learning outcome is then supported by a set of descriptors. So those descriptors just give an idea of the level and breadth of practice that is needed to really demonstrate each learning outcome. Learners can really engage with the framework by completing a learning needs analysis, and that enables them to identify their own kind of personal development needs and identify priority areas that they might want to focus on to start with. And by engaging with the pathway, it's supporting pharmacists to understand and engage with curricula and frameworks at a really early stage of their career. And we hope that they will kind of see the benefit in that it will help them improve their practice, and that's something that they can take forward as their career progresses. So the next element is the e-portfolio. So the RPS e-portfolio is mapped to the RPS curriculum. So it really helps to reinforce the use of the curriculum. So I mentioned the learning needs analysis just a couple of slides ago, and this is a screenshot from that. So this is part of the e-portfolio, and I think it gives a really nice intuitive interface, allowing learners to really engage with the framework. So for each learning outcome, pharmacists can self-assess and rank their current ability as high, medium or low. But it also gets them to think about if it's a high, medium or low priority for them and their practice at that time. So for anything that they self-assess as low or medium in terms of their current ability, and high or medium in terms of priority, you get that little icon kind of in the corner, the 3 lines. So if they go and click into that icon, a pop-up window appears, prompting them to come up with like an action plan. What do they intend to do to help them work towards demonstrating that learning outcome? So as part of the e-portfolio as well, there's a really wide variety of supervised learning events that learners can use to kind of work towards the learning outcomes, and it also provides a platform for gathering multi-source feedback. So as an educational supervisor, you'll need to register for collaborator access. So when your learner registers themselves with the e-portfolio, they'll have to input the details of their educational supervisor or collaborator. So they need to put your details in, and then you will receive an email with a link to click on, and then you can register as a collaborator for that specific learner. It's just worth keeping an eye on your junk folder because the email might appear in there rather than going directly to your inbox. So the next element is resources, and these are all mapped to the domains of the framework. They're free to access, and there's a wealth of resources that are available as part of the pathway, and it's really up to individuals and also organisations to decide how to use these resources. So they can be selected based on local or individual needs. They can be accessed through the newly qualified pharmacist pathway web page on the HEE website. So I think if you click on that link on the slide, it should take you to the web page, just so you can see kind of what's there. And to really help pharmacists engage with these resources, the early careers team in the North will be sending out monthly updates. So each update will focus on a different topic, and it helps to signpost learners to kind of relevant learning materials and also suggest any kind of activities or learning opportunities that they might want to undertake to really help them develop in that area. So this is a draft schedule for the update topics over the next 12 months or so. So essentially it's providing focus for those who want it. So some pharmacists might think actually all these topics look really, relevant to me in my practice. I want to kind of have a go at all of them. Whereas for some, they might think, oh, actually, some of these topics are covered elsewhere in the training that I already received, but maybe there's one or two that would be especially beneficial. So it's very flexible in its approach as to how people want to engage with it. It's important to mention that learners for pharmacists on the pathway will need to sign up for these pathway updates. So they need to register with the ePortfolio, but that they also need to register their details with HEE. So if you've got anyone in your organisation who is, talking about going on the pathway, please just check with them that they've also signed up with HEE, because we won't have their details to send the updates out unless they've done that. So in terms of access to supervision, this is the fourth and final element. So as an educational supervisor, you are a really fundamental part of learner support structures, and HEE have two training opportunities for educational supervisors. So there's a micro learning as part of the newly qualified pharmacist pathway, which gives an introduction to supervision, and then there's also pharmacy educational supervisor training, which is available through the e-learning for healthcare website. So I appreciate that a proportion of people doing the educational supervisor role will already have a lot of experience in that sort of role, supervising. So I think if you think that's you, just please have a look at these training programs and just have a look at the content, see if there's anything that you think you need a refresher of, that you might need to revisit, that might be beneficial to you. So I'm just going to hand back now to Annie, who's going to talk about funding and a couple of other bits as well.
Brilliant, thank you, Alison. So just to touch on funding and eligibility, the registration remains open. Those who completed their pre-registration training in the 2020-2021 cohort are eligible for funding, and this funding is provided to support educational supervision. HE will provide £500 for each eligible learner who signs up for the pathway in your organisation, and in order to access this funding, learners must sign up to the pathway by early March. We're yet to confirm the exact date, but we do recommend early sign-ups. So now that we've explored the components of the pathway, we want to revisit this image. We're offering this pathway to support a clear path for newly qualified pharmacists and early career pharmacists. We started by looking at the backdrop of education and training in pharmacy, and we recognise that what we are talking about is a culture shift towards lifelong learning. We know that this is a significant ask, and it will require everyone to upskill as educators. This is not something we're setting out to achieve alone. We need to work with you in collaboration to deliver this pathway and also refine it for future cohorts. You can help shape newly qualified pharmacist training for the future. So we've got some locations here of the key information relating to the pathway, and as Alison said, you can click on these hyperlinks. We've got the main HE newly qualified pharmacist pathway webpage, and all the information is on there, including sign up information. We've got the RPS webinar to support you with the ePortfolio, and it can be accessed via the same webpage. And of course, we welcome your comments and questions throughout the delivery of this pathway. And you can get in touch with the team using the Medicines Optimisation North email address, but you can also get in touch with us individually. We really want to form these relationships and learn what you think of the current pathway and how we can improve it for the future.